COVID-19 is present in Nevada, what you need to know and what you need to do. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat, Cashman Equipment, and additional supporting sponsors.
Residents of both southern and northern Nevada have been diagnosed with the novel coronavirus. Upon news of the virus, locals rushed to the stores, buying up face masks, toilet paper, and bottles of water. Conventions have been canceled, Washoe County closed some schools, and tourists are delaying their travel plans. But is all this preparation actually needed? To differentiate between panic and smart planning, we are joined by Brian Labus, Assistant Professor at the UNLV School of Public Health, and Dr. Jeff Murawski, Chief Medical Officer at Sunrise Hospital Medical Center. Well, Brian, Jeff, thank you so much for being here. We really appreciate it. This is obviously a very important topic, especially now. And Brian, I wanted to start with you. You were on the show several weeks ago, and we were talking more broadly about pandemics and epidemics. And we mentioned coronavirus on that show, but at that time we were talking about a very low risk. From a public health perspective now, has that risk grown?
Of course it has. We're not seeing an outbreak that's somewhere else in the world. We're seeing outbreaks that are here in the United States. So that is going to increase the risk. But we're also not seeing widespread disease transmission. We don't have millions of cases reported and tens of thousands of deaths or anything like that at this point. So it's something that's a greater risk than it was 2 or 3 weeks ago, but it's not the end of the world.
So I'm hearing community spread, first off, and that wasn't a term that we heard maybe 2 or 3 weeks ago. Can you explain exactly what that is?
So when we looked at it a couple weeks ago, we had cases in other countries, and the cases we saw in the U.S. were people who had traveled to those countries. When they came back to the U.S., they were diagnosed with the disease. Community spread means it's actually spreading from person to person in our community. We've seen larger outbreaks in Seattle, but in southern Nevada, we haven't seen much yet. We've had a handful of cases, but we're not seeing a lot of widespread transmission from person to person.
Now, one of the things that's kind of going around the rumor mill maybe is that we have a lot more cases than we actually are showing just because we have limited tests right now. Do you think that's an accurate assessment?
That's kind of a reality in any outbreak that we look at. There are always more cases out there than we really know about, especially when there's local transmission. When it was just coming from overseas, we might have been able to count them pretty accurately, but it gets more difficult when you're trying to find them in the population, especially when it's a disease like this that has a lot of mild symptoms. It's still flu season as well, so it kind of blends into all that background noise of respiratory disease, and it's difficult to find all those cases, especially if they're really mild.
Jeff, let's talk about that more. Then on the clinical side, my original question here, where are we? How severe is this? What's the scope of this from a clinical?
Well, I think, as Ryan mentioned, this is still flu season, and flu is still the predominant disease that we continue to see at the hospitals and our urgent care clinics across Las Vegas. Is it something we have to deal with? Of course, we have to address it. We have to screen appropriately. We have to test where necessary. But I think the key is it's still driven by what your clinical need is. So we continue to see people come in saying, well, I feel a little sick, let me get taken a look at. We're like, okay, well, you feel a little sick, go home, isolate yourself, take care of yourself, watch for fever. Those are the important things.
Comparing this to some of the other viruses that we've seen, H1N1, SARS, in severity and scope, how does it compare?
Sure, compared to SARS and MERS, this is less severe of a clinical illness. H1N1, this is less severe than the original 2009 swine flu we had, but we have that strain back in our community now, and we're seeing a lot of flu that's also severe. We don't really know the full severity. We do know that individuals who are older, so 75 or older, or those who are mid-50s or older and have a significant chronic uncontrolled medical illness are at higher risk from the disease, and those are the folks we're the most concerned about.
And when you say higher risk, is that just higher risk of death, or is that also transmittal and actually getting this?
So it's higher risk of having morbidity, meaning a kind of a complication from the illness, requiring hospitalization or medical care, and death. We don't know about the transmissibility, whether who's more likely to transmit than another. We do know that the virus transmits about 3 feet for contact touching and maybe 6 feet in the air between people. So that's where we get into the strategies of kind of keeping people out of large groups.
Gotcha. Brian, let's talk more just about some of these at-risk populations. We already mentioned 75 and older. Children is something that always comes up with viruses, but it doesn't seem to be affecting children in the same way, or is it?
Well, the data we've seen from China basically shows that children are not being infected, and if they are, they're not having really serious disease. So the deaths in children have been very rare, but the cases in children have been rare as well. So for this sort of thing, basically people under 50 have had really low death rates in China compared to the older populations that we already talked about with those chronic health problems. So it's really not an issue for children, teens, college-age students, people in their 20s, something like that. It's the older population that's going to be affected by this more than anyone else.
Now, if we are one of the target risk populations here, or we are in close proximity to one, what do we need to keep that's top of mind here?
Well, you have to think about how disease transmits from person to person. So it's a respiratory disease, so you're coughing and sneezing out these particles. The particles are rather large though, so they do fall out of the air after a few feet. It's not something that's going to be in a room and float around for hours like measles. So it's a different type of respiratory transmission. But anytime you're around people, you can spread disease to them. If you're coughing on something and they're touching it and then touching their faces, that's when they're going to get infected. So we're telling people the biggest thing is hand washing, because that's how it's getting to a lot of people. It's on a surface, you touch it, and then you touch your face. You've introduced it to the mucous membranes of your eyes, your nose, and your mouth. So hand washing is the big thing with soap and water. If no soap and water is available, hand sanitizer can be an alternative if your hands aren't visibly soiled. And then just that whole idea of distancing, keeping away from other people. If you have a chance to sit a few feet away like we are, it's better than being right on top of you.
And as Jeff said, 3 feet, I've heard 6 feet. Do we have kind of a tolerance of what that distance should be?
Well, you have to be reasonable about it. There's situations where you can't sit 30 feet away from people, but if you're right on top of them, the risk is going to increase. As you get farther away, that risk decreases. With the airborne transmission, we think it's about 6 feet where those large droplets fall out of the air. That's about what we typically use for these type of diseases. But if you're at 5.5 feet, it doesn't mean your risk all of a sudden skyrockets. As you get closer to somebody, the risk is going to increase. And as you get farther away, you're going to start to protect yourself.
I want to talk about a scenario here, of course, where we have to be in close proximity, air travel, and we've restricted air travel. We just heard recently about some of the national restrictions, but domestic air travel is still occurring. What are some of the things we can do? Are there places to sit on the plane, gloves, masks? What might we be able to do there?
Well, air travel has always been a challenge because you have a lot of people in a confined space sharing the same air, sitting on top of each other. So the recommendations we give in air travel really aren't any different than it would be in a classroom or your workplace. Cover your mouth if you're coughing to protect other people. Wash your hands. You can wipe down the surfaces of your seat. And if somebody's really sick, you can ask them not to cough on you, but you can say something to a flight attendant, because the guidance that's come out for CDC talks about taking sick people on planes and moving them away from everyone else to reduce that risk of transmission. So the same things you would do in your day-to-day life, you can do on an airplane. It's just a little more difficult to do them because you don't quite have the freedom to get up and walk around, and you don't have as much control of the environment as you do in your day-to-day life.
Jeff, Brian's saying day-to-day life can continue here.
Yeah, and day-to-day life can continue.
Yeah.
I mean, I think the key, he mentioned it, is to wash your hands. Wash your hands more frequently, wash your hands often. How do you do that, right? Simple advice. When I wash my hands, I sing happy birthday to myself twice. It gives me enough time to get it there. Some people do Mary Had a Little Lamb. It doesn't really matter. It just gives you that kind of 20 to 30 second good hand washing, or I use hand gel if I can't get to that. And that's really the key for people who don't have at-risk conditions. For those folks that are at higher risk, they need to think about, when do I need to go out? What do I need to be doing in large spaces with lots of people? That doesn't mean you can't have your family members over for dinner. But I think all of this, and this goes to the travel, gets to that individual responsibility of, if I have a fever and I don't feel well, my responsibility is to stay home and distance myself and limit any potential spread I might make. So this really gets down to that individual responsibility of, I choose not to expose other people. And the flu is still more my concern than coronavirus in this case, because you're more likely to spread that around. And if you haven't gotten a flu shot, there's still time.
So I want to come back just to get a little more into the weeds, I guess, on the hand washing side of this here. We see on TV maybe surgeons that are really going to town on their hands. I mean, is that what we need to be doing? Is this a lather the whole hand for 20 seconds?
Oh, goodness. So, you don't have to do surgical scrub. While I love my surgical scrub and my hand brush and all that fun stuff, really all you need to do is soap and water. Warm is obviously more comfortable. You want to get a good lather. You want to coat your hands. Usually we tell people that you always want to wash from the middle out, so you wash your hands and then go down to your fingers and rinse it off in 20 to 30 seconds. That's really what you want to get, is a good antibacterial soap wash. Or if you can't do that, then it's hand hygiene with the hand gel. And for hand gel, it's literally you have to work it in till your hands feel dry, that you've worked it all the way in. That should take about 20 seconds to do that. And that's what you do. And that's for touching, for contact. Those are the kinds of things that really it reduces.
Brian, let's talk more just about the cleaning that we've already mentioned here, wiping things down with disinfectants. Specifically, are there certain types of disinfectants we should be using or should not be using here?
Well, there's a whole list online that the EPA put together of products that work, but the ones you'll find in your home are things like alcohol-based products, bleach-based products, and Lysol wipes and things like that. So really the common products you have around your house, a lot of those will work against coronavirus. The challenge is you can't clean your entire environment. You can't wipe down the world. You're going to be coming in contact with other surfaces that other people have contaminated. So if you live alone and you work at home, cleaning the surfaces of your house really aren't going to do anything to reduce your risk of exposure because somebody else isn't coughing on those surfaces. But in a shared office space, it makes sense to wipe down those surfaces because that is going to keep it from getting on your hands. And we're doing that in addition to hand washing, because hand washing is going to take it off your hands. That will help keep it from your hands in the first place. But both of those ways can stop you from infecting yourself with the virus.
And that's extremely critical, that when we're talking about containment, hand washing, we're talking about potentially spending our time at home. It's not just for our own personal safety. This is the much more broader public safety piece of this. Let's just talk about containment. Why is this so important right now to make sure that we are following these practices?
Well, there's your personal health reasons. So you were interested in protecting your own personal health, obviously. So the more you do right now to protect your health, the better your chance of avoiding the virus in the first place. And then there's that second piece of our societal obligations of protecting other people. So if you do get sick with it, stay at home. Don't go to work. Don't be around other people. That's one of the biggest challenges we face, is getting people to stay home when they're sick. Every year in flu season, you'll go to your office and there'll be somebody else there coughing and sneezing because they absolutely feel they have to be there that day. And some of it has to do with people feeling that they can never be away from their job, that they're indispensable. But other parts are, it's challenging for people to miss work. You don't get paid if you miss work. Even if you have sick time, a lot of times you're not getting the tips and things like that. So it's very difficult financially for a lot of people to avoid work. But if you are going out in public with a disease, you have that potential to spread it to other people and infect a lot more people, the ones you care about closest to you. You don't want to sneeze on them. You should be doing the same thing for strangers and your coworkers.
We'll talk more specifically just about the treatment phase here, but if you are experiencing cold symptoms, let's say, and that's as far as they go, should you be extending your time away from work if you have the opportunity to, or is it just when these symptoms are existent you shouldn't be at work?
It depends on what you're infected with as to how long you're likely to spread it to other people. For most things, by the time you're recovering, the risk of transmitting to other people goes away because you're not coughing and sneezing and putting that bacteria virus out in the air because you're no longer sick and having those symptoms that allow it to spread.
Jeff, you mentioned flu is still a much bigger concern right now locally. I have heard that the flu shot could actually help coronavirus, not that it provides some form of immunization, but it simply could reduce bottlenecking that's happening in our healthcare system. Is that true?
Well, the hope is that if we use the flu shot and we reduce the demand for healthcare services, that creates capacity for us to take care of sick people when there's an unexpected outbreak like this. So there's only so much healthcare capacity in Southern Nevada. We're going to fill that up. We always have challenges with that here in town. And if we keep our flu controlled, then we don't use that capacity for flu. We can use that capacity for those individuals who get the coronavirus that we have to treat and take care of.
Yeah, Brian, that's a great point Jeff's making here. We're one of the worst in access to health care. We know we have doctor shortages here. We're confronting something like this. It seems like not only on the flu side, but just where containment is so important, is to just make sure that we're not getting a bottlenecking in our current healthcare system.
That's a concern anytime there's an outbreak, that everybody's going to run for medical care when they don't need it. We talk about the worried well a lot, and the easiest way to think of the worried well is pretty much anybody who's not sick. The entire community is concerned about this, so the first time somebody gets allergies, they get the sniffles, they're running to the doctor because they think they need this advanced care because they might have coronavirus. And so you have to really be realistic about what illness you have and do you actually need to go to the emergency room. If you're having shortness of breath, you can't breathe, problems like that, of course you should go to the hospital. But if you're just feeling a little under the weather, you don't really even have a fever, just some sniffles and don't feel well, that's the time to stay home and manage it just like you would any normal cold or flu that you deal with. We don't want people to not seek care, but at the same time, we don't want them to unnecessarily seek care and completely overwhelm the medical system.
Urban versus rural, are there any differences in how we are at least specifically focusing on containment?
In the rural areas, they have the benefit of being a little more spread out. When you get to the rural areas of our state, people don't live in close contact like they do in Las Vegas or in Reno. So the approaches we take, though, are basically the same. You think about your time spent with others. Instead of going to the popular restaurant in town, you may decide not to do that, or you may sit outside. Just ways that you can reduce your exposure to other people. It's really no different between local and rural places, although they just have that benefit of being a little more spread out to begin with.
So Jeff, we've just been talking a little bit about symptoms. Let's go specifically into that. What are the specific symptoms we really want to be concerned about when we're talking specifically about COVID-19?
Sure. So when the CDC puts out the screening, they really look at a couple of things. One is the asymptomatic person who traveled to one of the 5 high geographic area countries: Italy, China, South Korea, Iran, and Japan. Those folks really need to talk to the health department when they return, because they have an asymptomatic quarantining period they have to address. For folks that have symptoms, if they've been exposed to a laboratory known case of COVID disease, and so there are only a few in Southern Nevada right now, you may have been exposed to someone that has a laboratory diagnosis. We're looking, do you have a fever or a cough? Very simple symptoms, because you already have that exposure. Those individuals we want to bring in, we want to test them. If you don't have that and you don't have the travel, what we're looking for right now is a fever and a cough and signs of a severe lower respiratory tract infection. Really pneumonia that we can't find another cause for. So typically we'll say more likely it's flu or it's regular bacterial pneumonia. And so we're going to test you for those. And then we're going to start thinking about COVID disease. But it's really that combination of fever and severe lower respiratory tract infection. If you just have a fever and no other symptoms, if we think about what's going around in our community, that's much more likely to be flu. Should you call your doctor and get a flu test? Very possibly, especially if you haven't been vaccinated. All the regular diseases go around, and one of the things I always want to remind people is we talk about this as being novel coronavirus, because there is common coronavirus that we see every year in children, and it's a cold. But that's on some testing that you can do, and so people will get common coronavirus. Okay, stay home 7 days, no problem.
And temperature, big range here. What are we looking at? Just a couple points up?
Fever, 100.5 is kind of okay, we need to be thinking about it range. Though again, if you're one of those older adults with chronic medical illnesses, your ability to get a fever may be a little less. And so it's that, boy, I have serious cough and shortness of breath and I just feel like I have pneumonia. I need to get seen, and we'll take a look at it from there.
Brian, I'm wondering, we're talking about this now, and of course it's top of mind, but let's go along 2 weeks, and maybe now you have symptoms and you're wondering, do I have or do I not have? Are there any assessment tools or anything we have or resources we could potentially access to be able to kind of help us with the decision making here?
There isn't really anything out there for individuals, especially at this point when we're not seeing a lot of community transmission. I think if we're seeing this as a widespread disease, we can look at what else is circulating, and that guidance will start to show up of when should I see the doctor? What is it likely that I have? Like we said, flu is a common thing right now, but in a couple of months, flu starts to go away. And if we're still seeing a lot of respiratory disease, it may be more likely that it's coronavirus. We'll have to basically make those decisions as this virus and other viruses progress in our community.
Jeff, it sounds like, again, if we're not having all this criteria here, it's all about self-management. Even if maybe you have all the criteria, it's still about self-management here. Where's the break-off point then when you really should be seeking medical attention and going into an ER or urgent care?
I think you have to use the same common sense you used a month ago or 2 months ago. If you think you need emergency treatment, then you need to go to an emergency room. If you don't, you want to talk to your physician or your nurse practitioner or PA or a medical professional and see what their advice is. And you can call the health district if you're super concerned about coronavirus, and they have a helpline that will provide you with some information as well.
Let's talk about remedies. All right. Again, we're talking about an individual that has all the symptoms, whether it's coronavirus or not. They're potentially treatment at home here. Common flu medication, so regular hydration.
Symptomatic treatment: stay well, stay healthy. Flu-like treatments, and then if you're super sick, there are medications that the FDA has that we use for confirmed cases.
Brian, can you give us an idea, just percentage of those that are being hospitalized and those that are in home care now and those that are recovering? Are there ratios that we have?
What we saw from China basically was about 80% of the people had a mild illness, the kind of people that never had to seek any sort of care at all. 15% had a more severe illness, and then 5% had that real critical illness where they could wind up in the ICU. They needed hospitalization because the symptoms were severe. But then there's all those people that had a mild illness that never came to the attention of the health authority. So we know that 80% should be a bigger percent because we just don't count those people because we can't find them. They had a mild respiratory infection that was like a cold to them, so it never came to anyone's attention that they had this particular virus.
And the 20% that's being hospitalized, what percentage of that then are this high-risk population we've talked about, is 75 and older, or chronic?
Well, it really doesn't make sense to talk about what it is in China because they have a different population. Italy has a different population. They're older. They're going to see the outbreak spread differently in our community. So we have to think about what our risks are. You wouldn't expect to see only 20% in a nursing home outbreak. You're taking the most medically fragile people. If there's a big outbreak there, a lot of them are going to need serious medical attention. You have a cluster of kids that wind up getting it. Probably nobody's going to need hospitalization. So it really depends on the group that's being affected, and we have to think about the makeup of our community and how that affects who's getting sick.
Jeff, do we know if you do contract coronavirus and you're at home and you recover fine, are you immune to getting it again?
We don't know for sure. There are studies that are done off, again, the Chinese experience, which is not ours, that say there is immunity in some people to the coronavirus after they've had it, but we don't have the confirmation on that. I think it'll be a while before we have the science to say, yeah, that means you're immune or not.
Do we have any idea how long that could take?
Well, it might take us a year to understand it fully and to really get that information out of there. So, and it'll also be part of the kind of vaccine development questions you have to put together.
Brian, we talked a little bit about the testing here. We have limited testing now. Do we have a timeline of when we are going to have more robust testing to be able to cover all the concerned patients we have right now?
You're never going to be able to cover all the concerned patients, but we'll be able to cover the people who actually need testing. And that's a big difference. Just showing up at your doctor and demanding to be tested for coronavirus is not the way to approach this. We have the test kits in our community through the public health lab, a small number of those, but it's becoming widely available through the commercial labs. And as time goes on, more and more kits are going to be made available. It's really fascinating to look at this, that we basically discovered this virus at the beginning of January. By the middle of January, they developed a test kit for it, and now just a few weeks later, you can get tested at a commercial lab worldwide. That's an incredible speed that we've used to move forward to get lab testing to our population. And we have the ability to produce more kits. It comes down to how many we actually need, though, to test our population. And we're not hearing stories of shortages of test kits, and that's what's really driving it. The challenge is testing the right people, because you don't want to just use the kits just to use them.
Right. Let's go back to the quarantine question here. How long, whether you have any symptoms, whether you might have the symptoms of coronavirus, but maybe you haven't been tested positive yet, is there really a general span of time that we should be staying at home away from work?
So the quarantine that we've used for this entire outbreak has been 14 days. We aren't 100% certain on the incubation period for it, but based on other coronaviruses and what we know about disease, 2 weeks seems to be a reasonable amount of time to say if you haven't developed any sort of illness in that amount of time, you're not likely to be doing that. So we've been using a 2-week quarantine when people return or after they've been exposed to other people in our community.
Jeff, we're talking a lot just about addressing coronavirus itself. I wanted to talk a little bit about the mental health aspects of this here. A lot of anxiety, a lot of stress around what's happening right now and what we're seeing on the news. First off, give us some advice. How can we manage this?
So I think the first thing is, stay calm. Don't get your news through the grapevine. I mean, I'm a big Ferris Bueller fan, and wonderful scene in the movie where they talk about Ferris being ill, about hearing from their brother's, sister's, cousin's hairdresser. That's not how you get your information. CDC.gov, our health district website, the state's website for public and behavioral health. Get your information from there. So reduce your anxiety, get your information from the right places. And then you have to think about, how do I manage my stress? And what do I do to manage my stress? That can be exercise, that can be eating well. All of those things are really important. And really, when we get into social distancing from a kind of mental health perspective, that's really, how do I keep the connections to the people that matter to me? And we have wonderful technologies now that help us do that. Video chatting, social media, those things are all really good still to stay connected to people, to not feel isolated. Just because we put you in quarantine doesn't mean you shouldn't talk to people. It just means that we should have you limit your physical contact. That doesn't mean you can't have emotional contact. And that's really one of the important things to keep you healthy.
Brent, I want to come back to, we just have another minute or so. I want to come back to the talk with employers here. What should you be communicating to employers? What should employers be communicating to you right now related to the coronavirus?
The challenge with this is figuring out what's best for each individual business. Some of them can easily send all their employees home and work remotely and allay all those fears about any sort of disease transmission, because working in an office can be easily taken home. But you can't do the same thing if you run a store. So employers need to communicate with their employees about what's going on, what they're doing, and what's kind of the most recent information and the recommended steps to protect themselves and to limit interactions with customers or do it in a way that's going to be safer and really reduce their risk of disease. And then people need to think about their personal health issues. If they have those underlying health conditions and things like that, they may need to take some special steps in their employment situation to reduce their risk of disease transmission.
Wonderful. Well, thank you so much. This is a great conversation. We really appreciate it. Thank you. Now, if you'd like to learn more about anything that we've discussed today, please visit our website at vegaspbs.org/Nevada-Week. You can also always find us on social media at Nevada Week. Thank you so much for joining us. If you'd like to learn more about anything we discussed today, please visit our website, vegaspbs.org/Nevada-Week. You can also find us on social media at Nevada Week. On our Vegas PBS website, we have also added a special section about COVID-19. There you'll find all the latest videos from both Nevada Week and PBS NewsHour. The page also has an abundance of resources to help you talk to your kids about the coronavirus. Stay up to date by visiting vegaspbs.org.